Arthritis is a general term that describes inflammation in the joints, which can lead to pain, stiffness, and limited movement. Those afflicted often experience chronic discomfort, especially in the hands, knees, hips, and spine, which can be aggravated by motion and result in a reduced range of motion over time. Symptoms can also manifest as swelling, redness, and a sensation of warmth around the affected joints, sometimes accompanied by overall fatigue and a feeling of malaise. Treatment varies depending on the type of arthritis, but can include medication, physical therapy, lifestyle changes, and in some severe cases, surgery to repair or replace damaged joints. Risk factors for developing arthritis include age, family history, previous joint injuries, obesity, and certain autoimmune diseases. Here's a dive into the detailed aspects of arthritis, exploring how this condition impacts lives and what can be done to manage it. Symptoms and progression of arthritis. Arthritis encompasses a range of joint disorders, of which osteoarthritis and rheumatoid arthritis are the most common. Symptoms typically begin as a subtle discomfort, often described as a dull ache or stiffness in the joints, especially after periods of inactivity or excessive use. This condition progresses as cartilage, the cushion between bones, wears down, leading to swelling, increased pain, and reduced flexibility. In rheumatoid arthritis, an autoimmune form, systemic symptoms like fatigue and fever may appear, as the body's immune system mistakenly attacks its own tissues, causing joint inflammation and damage. Severity can vary, with flare-ups and remission periods affecting mobility and quality of life over time. Diagnosis of arthritis. Diagnosing arthritis involves a multifaceted approach, as symptoms often overlap with other conditions. Early detection is key to managing pain and preventing joint damage. Physicians generally start with a patient's medical history and a physical examination, checking for joint swelling, redness, and warmth. Lab tests such as blood work can identify markers like the rheumatoid factor indicative of rheumatoid arthritis, while imaging tests, including X-rays, MRI, and ultrasound, are employed to assess joint degradation and inflammation. Prompt and accurate diagnosis is essential, as some forms of arthritis, like septic arthritis, can lead to rapid joint destruction and require immediate treatment. Cause and risk factor of arthritis. Arthritis, a term that encompasses over 100 different conditions, is caused by a variety of factors, which can influence both its onset and severity. Genetic predisposition plays a significant role, particularly in autoimmune forms of arthritis, such as rheumatoid arthritis, RA. Environmental factors, though less well-defined, include exposure to infections and tobacco smoke, which are associated with increased risk. Occupation is another aspect to consider. Those engaging in repetitive joint stress or injuries are more susceptible. Age is a pivotal risk factor, with arthritis prevalence increasing in older populations. Other notable contributors include obesity, which adds stress to weight-bearing joints and heightens inflammation, and gender, as certain forms of arthritis, such as RA and lupus, are more prevalent in females. Understanding the interplay of these factors is crucial in both prevention and management strategies for arthritis. Diagnosis of arthritis. Diagnosing arthritis presents a complex challenge due to the disease's many forms, each with its own symptoms and progression rates. Rheumatoid arthritis, RA, osteoarthritis, OA, and psoriatic arthritis are the most prevalent types. RA is confirmed through a combination of blood tests, such as rheumatoid factor and anti-CCP antibodies, and imaging scans like MRI and ultrasound to detect joint inflammation before extensive damage occurs. OA diagnosis relies more on physical examination, patient history, and X-rays to spot joint deterioration. Psoriatic arthritis requires careful observation to differentiate from other types, using criteria like nail changes and skin psoriasis combined with imaging studies. Early and accurate diagnosis is paramount for initiating effective treatments to slow disease progression, manage pain, and maintain joint function.